back with another video. Guys, I'm so excited to be here to film this video. Like, I feel like it's been a little while and I'm so happy I'm here to share some good news. So I just got my first job as a registered nurse. I just got hired on an NICU unit at a hospital and I'm so thankful and so happy because I feel like I've just been on this journey. And you know, I filmed a video about me studying for my NCLEX. I finally passed that, and then now I'm able to work at my first job. So today I have an exciting video, and I know it's gonna be so helpful to a lot of you that are, you know, new grads, and you are, you know, finished writing your NCLEX, or you're looking for a job, you're trying to apply for a job, and you want some tips on how to go about doing an interview or how to prepare for your interview. So that's what this video is about. I just want to share what I learned, everything that I learned. I'm going to be telling you guys a little bit about my experience when it came to applying for jobs. I'm going to be telling you guys about some of the questions that they asked me, some of the things to look out for, tips overall. So I'm going to get into that. So if you're interested in that, keep watching. So I ended up taking off my glasses because I don't want the glare in this video. We're not doing that, no ma'am, today. Let me share some tea about me and my interview process, okay? Before I landed this job, I interviewed for 4 different positions, or at 4 different places. Everything has been online, so these were all virtual interviews. The first one was actually mental health nursing, right? But with that one, I thought it was like a job fair where you kind of go in and ask questions. I didn't really expect on-the-spot interviews, so I did prepare for a little bit, but I wasn't fully prepared. So like that was a little different. I kind of already knew by the time I got off the phone that I wasn't, or by the time I got off the Zoom call, that I wasn't gonna get it. But that was my very first interview. From there, I was like, okay, this is like, it's getting serious now. So anyways, I was like, yeah, now it's getting serious now. Now I need to actually prepare and do the right thing when it comes to these interviews, because I can't keep having them be this bad. So the second interview I had, it was kind of like a med-surg unit, and to be honest, from my consolidation, I didn't have that much experience working on a med-surg unit, because even when it came to like my med-surg rotation in school, unfortunately that semester, because of COVID, it had been canceled, so I didn't get that experience. And so in general, I just feel like coming out of school, which I think a lot of you can relate if you did finish nursing school or had a portion of your time in nursing school during the coronavirus time. If it was during COVID, then yeah, for sure you're going to have some gaps in your knowledge, if that makes sense. Like, or you might feel like you are not as prepared because maybe some time that you should have been in clinical, that was taken away because of what was going on in the world. You couldn't go into placement, so then they had to replace that time with maybe a virtual learning option. So a lot of the students graduating at this time feel that way, and I feel you on that, because I feel like although I was interviewing for a lot of these jobs, even though I did a consolidating placement, which I'll get into next, I just didn't feel like overall my experience was vast. Like, I didn't feel like as a student I got a lot of learning opportunities that I should have, just because I kind of got the short hand of the stick. If you didn't get a good placement in your last year, you didn't even have a placement, you have to do virtual placement, then you're kind of like a little bit screwed, because you're coming into the workforce as a nurse and you don't have a lot of experience, if that makes sense. Pre-consolidating placement, which is the placement the semester before, I actually did that at a long-term care home, and like hands-on skills, I didn't really get the opportunity to perform them, because if you are familiar with long-term care and the registered nurse's role in the long-term care, it's more of a management administrative role. So that was kind of what I was focused on and what I had to do. Last placement before graduation, that one I did it in the NICU. Because I had that experience in the NICU for my consolidating placement, like when I did interviews that were for that unit, the NICU, I knew what to say. I was much more comfortable and I was much more confident versus when I did my very first interview, which was in the mental health. I'm coming from a place where I was just on the NICU, and then now they're asking me questions about mental health, and I don't have that experience to draw on because it's not as fresh in my mind, if that makes sense. So yeah, I just kind of feel like where it's easier to, like, if you get a position, if you get a clinical placement on a unit, it's easier to interview for that unit after graduation because you have that experience and you can say, oh, I learned this skill, I learned this skill, I learned this skill, versus, you know, if you never had that experience before. It's not that it's not possible, you just have to be more prepared, but I'm just saying from my experience, like when I did the NICU interview for the job that I have currently, that I got offered, I was a lot more comfortable because I had that experience. Okay, actually I felt like the first two interviews were pretty bad because again, like I don't have that mental health care nursing experience. I don't have a lot of med surge, you know, nursing experience. After that, I did two I did two interviews, and both of them were from two different hospitals, but they were both NICU units. And those two I felt so comfortable in. Like I feel like I was able to answer the question. I was able to draw on those experiences that I had last semester in clinical, because those are fresh in my mind, and so it was really helpful to be able to draw on that and talk about my experience. This is what I mean by when I say like I was more comfortable when I was doing my NICU interviews because I knew that specialty area a lot more, right, than mental health. So my point is, you need to research your specialty, right? You need to research your special emergency department nursing position, right? Or if you are going into a cardiac unit or something on that sort, you want to really research that specialty. You want to ask yourself, what are some common assessments that they do on that unit, right? You want to research what are some common diagnoses that, you know, you might run into on that unit. Like literally Google it, write a list, and then research each of them. For example, like if it's like congestive heart failure or heart attack, pain assessments, right? Think about if you had a patient with these type of complications, what would be your action? What action you would take? What diagnosis you would take? What type of symptoms you would expect, right? And what would you be observing for, right? So whether it's like, what are certain things that you would observe for increased heart rate or decreased heart rate? Also get familiar with some of the equipment that you might see on these units. And the reason why I say that, to be honest though, like, yes, when you are hired, you're supposed to get trained, and you will get trained, but just have a general idea. For example, in the NICU, some babies are on CPAP, right? This is continuous positive airway pressure machine, right? And this allows for the baby's lungs to stay open, right? It prevents it from collapsing, and it helps it with breathing, and overall, like, some babies can't breathe, need more assistance, or they have issues with breathing, so they might be placed on CPAP to assist with that. So if you are interested in applying to an NICU nursing position and you're not familiar with what that is, if they throw you a question that involves CPAP, you're not going to know how to answer. So at least know what it is. Make a list of examples of things that you did in lab or things that you did in clinical, and those experiences you can look back at your reflections at your clinical evaluations, what your preceptor had said about you. Like, think about those and try to answer this question to the best of your ability. But this specific question, tell me about a time when you had to make a difficult decision, and how did you handle it? This could also be seen as like, tell me about a time when you had to deal with an emergency situation, right? So phrase different, but they're asking basically the same thing. And again, they just want to see, how did you handle this situation? What did you learn from this situation? Like, what actions you took place, and if it was like positive. Even if you did have to make a difficult decision, they want to see how do you work under pressure, you know, and what did you do to think, or how did you think critically, and what did you do? Strengths and weaknesses. So I feel like this is a question that they ask all the time, like, tell me your strengths and tell me your weaknesses. Come up with a lot of strengths. I want you to come up with at least 5 strengths. Five different strengths, write them down. Weakness, at least come up with 1. Bare minimum 1, because they always ask that. And for strengths, you know, you can say something like, you know, I'm super passionate about this population. You know, I have great organizational skills, great time management skills. I'm a fast learner. These are just examples, right? Like, think about you and what you can bring to the table and what areas you're strong in, and it will and your answer might vary depending on the specialty. A weakness could possibly be that your lack of experience just overall as a nurse, right? You're a new grad. Think about that, right? You're a new grad, you're coming onto the unit, or you're coming onto the facility fresh out of school. You don't have years of experience. My lack of experience as a nurse. However, this makes me eager to learn, and so I'm very dedicated to, you know, honing my craft and just being committed to my learning. If you guys enjoyed this video and you like some of my tips, please subscribe, give me a thumbs up, let me know in the comments below what you thought about this video.